Promoting Health Wednesday, and tonight we're going to talk about chronic inflammation and what inflammation is in the body based on this month's newsletter from Stephen Horn. So inflammation is actually the underlying cause of chronic disease and pain. Inflammation happens to be the body's normal response to damage, and it actually activates our immune system, and it also sequesters an area to slow the spread or toxins or infection. So when we have, tissue damage, we have swelling, white blood cells, everything kind of comes to the rescue in the body. So there's swelling, there's heat, there's redness, and usually there's pain. So swelling slows the flow of fluids to inhibit toxin and bacteria from spreading throughout the body. Heat is caused by an increase in oxidative processes at the site of an injury. Redness occurs with the red blood cells accumulating in the local tissues around the injury. And pain is a signal to the brain that an injury has occurred. Itis is inflammation in Latin. So when you have arthritis, it's inflammation of the joints, bronchitis, the bronchi, colitis, the colon, neuritis, the nerves. So the healing process is, you kind of have an injury and you have some bleeding, then it inflames, then it starts healing, and then it remodels. So once the infection or toxins are contained, a new set of inflammatory messages are released that initiate a healing process in the body. Fluids removed from the tissue spaces, lymphatics, and then normal circulation's restored. So chronic, that's a normal process of the body with inflammation. Anytime there's an injury or something's going on and the body's trying to protect itself, this healing process and this inflammatory action occurs. So chronic inflammation is when the healing process isn't initiated, inflammation can become chronic. So you have an injury and your body's not really able to come to terms with it. And that can cause reduced circulation and a lack of oxygen and nutrients to the area where the tissues are damaged. It also can result in accumulations of waste material and energy levels. If they drop, plasma proteins may clot in the tissue, resulting in chronic fluid retention. So chronic inflammation and degenerative diseases kind of go together. So when we look at chronic inflammation and degenerative diseases, we're thinking of certain types of cancer, some neurological diseases, some pulmonary diseases like asthma, COPD, hay fever, bronchitis, bone and joint diseases, osteoarthritis, osteopenia, rheumatoid arthritis, metabolic disorder like type 2 diabetes, renal failure and kidneys failing, fatty liver disease, cardiovascular disease, heart failure, stroke, high blood pressure, autoimmune disorders like Crohn's, colitis, lupus, type 1 diabetes. So a lot of these things occur in conjunction with or because of chronic inflammation, not really sure. But when you first have an injury and you want to treat it, we're just looking at acute inflammation. And the best way to prevent it becoming chronic is to treat all acute injuries and infections seriously. So there's remedies that can actually reduce inflammation and promote healing. Following injuries, a lot of people use homeopathics like arnica, yarrow, calendula, remedies that can help with acute infections, outside of going to the doctor for antibiotics. There are some, herbs like echinacea, garlic that may be beneficial. And you want to make sure that you take your injuries seriously and treat them properly, okay? When we look at Matthew Wood, who was a Native American teacher, taught us that every bruise, no matter how small, should be attentively cared for because it could give rise to bad blood, and that bad blood can develop into other things even years later. The Chinese also have the same concept that stagnant mucus can precipitate into soft, movable things which are generally non-malignant but stagnant blood. And those things can lead to further disease. So when you look at different philosophies in the Native American and Chinese, regardless of the bruise size or the seriousness of injury, you shouldn't dismiss it. And for some reason, there's healing doesn't take place in the body. So maybe the source of your injury was never removed. So the irritation and damage to the tissue is ongoing, or your body lacks the nutrients or energy it needs to initiate the healing. So if you have like a problem of ongoing tissue irritation, think of like an unremoved splinter. You get a splinter in your hand, and that causes the area to become red, swollen, and inflamed. And the sliver's not removed. It's going to continue to be irritated and inflamed. And then it's going to lead to what Stephen refers to as the splinters of chronic inflammation, where you're going to have unremoved toxins, you're going to have some low-grade infection, and you're going to have ongoing irritation. Chronic inflammation also can be brought on by poor nutrition. So you're eating foods that aren't nutritionally valuable to the body, so the body can't do what the body needs to do. So you have low energy levels, you don't have vitamins and minerals, you're eating a lot of fat. It could lead to constipation, type 2 diabetes, high blood pressure, depression, obesity, cholesterol, nutrient deficiencies, and cardiovascular problems. I mean, it's really well known that our diet and our lifestyle really impact our health, because a lot of those things, like metabolic disorder, heart disease, are brought on by poor lifestyle habits. So one of the most important things you can do to stay healthy and to help your body recover from injuries is eat healthy foods. You know, eat healthy fats, lots of vegetables, and lots of fruit. So if you happen to be suffering with chronic inflammation, you need to assist the body in trying to reverse that. And there's 3 steps for me for anything that's wrong with you, and that's to detoxify, eliminate the irritants, and use herbs, nutrients, and foods to reduce inflammation and promote healing. So anyone dealing with chronic inflammation or chronic disease probably has an issue where they need to detoxify. If they're weak and feeble or suffering from autoimmune conditions, you want to go slowly on detoxification. And detoxifying doesn't mean like taking all these cleanses and, you know, forcing the colon to purge. It's more lifestyle, drinking water, drinking nutrient-dense foods to build up your body so your body has the nutrients it needs to naturally cleanse and perform its function. A lot of people don't take in enough fiber, so adding psyllium, a fiber, maybe some aloe vera or chlorophyll can really help your body in cleaning itself out. You also want to remove the irritants. Removing irritating substances from your diet and environment, like lots of junk food, lots of sugar. If you work with chemicals, make sure you're taking precautions or try to work where you're more safe. And minimize the use of chemicals in your cleaning products, the drugs you may be taking or the medications you may be using, or smoking or drinking a lot of alcohol. So you really want to focus on eliminating irritants and healthy lifestyle. Definitely adopt a cleaner diet. Look for foods that are organically grown or at least grown without chemicals. Try to avoid food additives. Become really conscious of your labels. Eat whole, natural foods rather than processed and refined foods. And, you know, stay home. Cook a meal. Don't go out. You know what you put in your food. You don't know what they're putting in your food. Again, use non-toxic care products. So take a look at your shampoos and your laundry soap and your dish soap. Try to avoid lots of the use of a lot of chemicals, and focus on herbs and nutrients to reduce inflammation and promote healing. And those would be things like omega-3 essential fatty acids. You can find those in deep ocean fish and grass-fed whole milk dairy products, walnuts, macadamia nuts. White willow bark contains salicylic acid, which was the forerunner of modern aspirin, and that helps the chemical messengers mediate inflammation. So does frankincense. There's lots of fruits out there like mangosteen fruit and pericarp. They're very high in antioxidants and xanthones, which have huge anti-inflammatory properties, inhibiting free radical damage. Turmeric and curcumin, again, antioxidants, antibacterial, anti-inflammatory. There's tons of research being done on turmeric and its benefits, especially for calming down inflammation. Licorice root also has kind of a cortisol sparing action that helps support your adrenals. It can help with some pain and promote healing. If you have high blood pressure, you probably don't want to take licorice root. Yucca is another anti-inflammatory herb. There's chamomile. You'll see chamomile a lot in tea, and people put it in their baths. They'll use it in an essential oil. And it's very anti-inflammatory, although people with the oil need to be careful because of its familiarity with ragweed. There's also things like alpha-lipoic acid, vitamin C, green tea. So there's lots of things that you can do to help your body with inflammation. So remember, acute inflammation, red, swelling, pain, heat, and the area being warm are very normal when you have an injury. Think of a splinter or a bruise. But always pay attention to your bruises and your cuts and everything, and at that time assist your body in taking care of it so it can remedy the inflammatory process. So I hope that